Randy, the good news is that there are ways to treat this problem and some lifestyle changes that new moms can make to help with the problem. So this morning we are joined by Dr. Kevin Enger with SSM Health St. Joseph Hospital in St. Charles. Good morning, doctor. Thank you for joining us this morning. Can you tell us a little bit about why this issue is so common in postpartum women?
Yes, thank you so much for having me on today in this absolutely gorgeous Friday. Urinary incontinence affects about a third of women throughout their lifetime, and part of the reason why incontinence is so common has to do with the way the woman's pelvis and the musculature that support these organs kind of have to change to accept delivery of a baby. And these changes continue throughout the course of the pregnancy until the time of delivery. And it can take some time to kind of recover from these different changes. And frequently, in about a third of women, these changes do not completely reverse back to prior to delivery.
And we know there are some lifestyle changes that women can make to help with this issue. What are a couple things that people can do?
Excellent question. So the first thing regarding lifestyle changes is to try to identify things that may worsen your urinary control, whether it is dietary items such as coffee, soda, tea, any kind of food items that may make your incontinence worse, but also from a lifestyle perspective to make sure that you try to empty your bladder completely before doing things such as exercise. Now, as far as lifestyle changes, I think most women have heard of Kegel exercises, but there are more rigorous programs such as physical therapy that can help alter the ability to help hold in your urine.
And any other options for treatment or information when a woman should know it really is time to get help for this?
Absolutely. So frequently after delivering of a child, you can expect that up to 45% of women will experience some incontinence between 6 to 12 months. Now, after 12 months, the vast majority of women are able to regain the majority of their urinary control. But if the incontinence persists, or if you're having any pain, any blood in the urine, or if you're having significant difficulty with emptying of the bladder, then I would definitely seek medical advice. There is obviously medicines and surgical interventions that can be offered.
All right, Dr. Kevin Enger, thank you so much for joining us this morning. We will have information to this linked on fox2now.com in our STL Mom section.
Thank you
very
so much.
much.